when does a deviated septum becomes a sleep problem?
So deviated nasal septum is not the only cause of sleep problem. First, let me tell you that. So what happens in a deviated nasal septum is only deviated nasal septum also along with the turbinate hypertrophy. So imagine this is your nose, this is your septum which is deviated to one side, and then you have a turbinate which is right here. If both of these collide or both of these touch each other, then it becomes a problem of sleep because there is no air going into this passage. Meanwhile, if on the other side if there is a compensatory opening, so then it's still not a sleep problem. Suppose both the turbinates collide onto the septum, then it becomes a sleep problem. Secondly, suppose the airway is clear and then there is still obstruction in your throat, then it can become a sleep problem. So only deviated nasal septum cannot be a sleep problem. That is one thing which I would like to tell very clearly. So along with the turbinate hypertrophy, or if there is a gross deviation of nasal septum, like when we say there is a S-shaped septum, or when there is one septum where it's deviated to one side and then you have an extra bony growth in the septum which we call as spur. So that can be a problem for sleep for many people. That can cause snoring actually. So that is when patients come to us for the treatment part. So that is what is required when that actually causes a sleep problem.
So should someone on CPAP get their septum checked?
So before taking a CPAP, definitely you should get your septum checked. I would suggest first get the septum checked, then take a CPAP machine. That is the actual way to go. So first get your ENT checked, that is ear, nose and throat checked, and then get your pulmo checked, that is your lungs checked, and then only go for your CPAP machine.
Anyone who is suffering from the sleep issues, so at what point of time they should consider coming to ENT? Is it should they consider before going to pulmonology or after going to pulmonology?
So disturbance in sleep can be of many types. So some people they have a disturbance of sleep only because of snoring. Some people have a disturbance of sleep only because they are very anxious and they get up in sleep. Some people have a disturbance in sleep when they are unable to breathe and they get up having apneic episodes, what we call as. So anybody who has those things, so main thing to first come to ENT would be if they have a difficulty in sleeping because of the breathing issues or because of the snoring issues. So that is when a patient comes to us. So and that is when we decide whether the patient really requires a surgery or a CPAP machine. So that is the main thing.
So who actually needs surgery and then who doesn't?
The patient who actually needs a surgery is when they have a gross deviated nasal septum where they are unable to completely shut down, the breathing of one side is completely shut down, or they have a deviated nasal septum along with a turbinate hypertrophy and sinusitis, or they have complete turbinate hypertrophy and the septum is not that deviated. So that is when we do a minimal invasive surgery where we call a turbinoplasty and septoplasty is what we do surgeries for these kind of deviated nasal septum. Not everybody requires a surgery.
Oh, so what happens with the surgery just before, during and after the surgery?
Okay, so suppose if I can tell your example, if you are coming down to me as a patient and you have something like nasal obstruction or you have a snoring or you have an open mouth breathing, then you come down to us, we have a thorough checkup of your nose, we have a thorough checkup of your throat, and then we give a diagnosis of nasal septal deviation and we give a diagnosis of turbinate hypertrophy along with tonsillitis. So what we do is, suppose you have to treat your septum first. So if when treating your septum, we also see whether you are getting infected through your ears as well. So in case if you have an ear infection, then it's but and foremost that you have to get your nose treated first. If you undergo even a ear surgery, your ear surgery will not be a success if your septum is and if your nose is not treated correctly. So what we do is, I'll ask you to undergo a CT scan first. In your CT scan, we actually see about your turbinates, we see your septum, we see the overall sinusitis issues. Then we ask the patient that, okay, fine, we decide that you need a surgery and you need only a septoplasty. Suppose you need only a septoplasty. Then we tell you the procedure. So what exactly is the procedure? If you want me to explain, it is just a minimally invasive surgery. With the help of an endoscope, we first we give you a general anesthesia. On the day of surgery, we ask you to come nil by mouth and you're not supposed to take anything 6 hours before the surgery. Then we ask, once the anesthesia is done, then we start packing your nose with adrenaline and all so that there is a bloodless field during our surgery. Then with the help of an endoscope, we try to remove the excess part of the septum and then we correct it, and it's only through inside we correct it. There is no scar outside, or there is no, there's no change in your face or no change in your nose from outside part, because it's not a cosmetic surgery. It's just a small bone part which you're going to remove it from inside with the help of an endoscope. So that is why it's called a minimally invasive surgery. It's a scarless surgery basically. So once we remove this, your extra bone, and then we just give you one suture from inside, and then we pack it up with something with nasal packs, and those nasal packs are kept either for 24 hours or 48 hours depending on the blood loss. And then after 48 hours the packs are removed, and then the patient is good to go home. So that's your septoplasty.
So after septoplasty, when does a patient get back to their life?
So suppose a patient has undergone only a septoplasty. I'm talking only about septoplasty. Then after 48 hours, the patient gets discharged from the hospital, depending on 24 to 48 hours. And once you get discharged, you have to come down for a weekly cleaning of your nose for 2 weeks. So once you come down after weekly cleaning, and then we do a 1 month cleaning of your nose. So after that, you are good to go anywhere. So you can fly. You can go to your gym, you can do your weightlifting, and you can breathe easily, nicely if you have only breathing issues, and it can be treated with septoplasty.
So let's say the same patient after 1 year, how does the life changes before and after?
So if the patient is coming to me after a year after septoplasty, we have to ask them, like, how is your breathing then and how is your breathing now? Or how is your headache then and how is it now? So mostly it's with headaches, because septoplasty, what happens is when there is a gross deviation, when we operate, the turbinate hypertrophy, what I was explaining you about before, that causes the major headache. So people with a headache, they have a very positive impact of septoplasty on them. So their headaches are 90% gone. So that is the major impact. Then is the patient able to breathe better? I'm sure with that gross deviation, now the patient is able to breathe better. So that will be a better thing after a septoplasty.
So if someone is having frequent headaches, should they consider visiting an ENT?
Yes, obviously you should consider visiting an ENT, because headache can be due to many things which are related to ear, nose and throat. Like a deviated nasal septum can cause an impinging headache. Sinusitis can cause a very different kind of headache. We actually call it as a facial tenderness, not exactly headache in sinusitis. Then migraine headaches can be treated, and these are the headaches for ENTs. So in a deviated nasal septum, if you see, again the bone which is deviated, it will impinge on the tissues of the nose, and that causes a very impinging or pressing kind of headache. So that headache can be diagnosed if you come down to an ENT.